Hi, I'm Jennifer. I'm a midwife, and I'm going to talk to you about different fetal positions. For the vast majority of people, for the ideal position for their baby is what we call LOA, which stands for left occiput anterior. And so that means the occiput, which is the back side of the baby's head, is anterior, which is the front of the mom, and to mom's left. And we're not really sure why left is a little bit more favorable than right and why most babies tend to gravitate toward that side, but it tends to be the most ideal. In general, however, the baby's back and the back of their head being toward the birthing person's front is kind of the most important thing. When they flip the other way, where baby's back is lying against the spine of the pregnant person, that can lead to more back pain. It can lead to the wider part of the baby's head trying to be birthed first, which is a little bit more challenging. It doesn't mean that you can't give birth vaginally or unmedicated. It can just be a little bit tougher, a little bit longer. And so we really try to help encourage our moms in labor to get in positions to help their pelvis accommodate that baby to rotate into that favorable position where they're more anterior. Sunny side up or posterior is where the baby's back is along the mom's back. And it's fairly common during pregnancy, not really a huge problem, but once you get into active labor, usually we really try to encourage these babies to sort of rotate to where their back is towards the front. It can definitely cause more back discomfort, back pain in labor, which can be a little tougher to tolerate and tougher to use coping techniques with than just regular contraction pain in the front. And it leads to where the bigger, less moldable part of the baby's head is coming first instead of the narrower, more cone-headed, moldable part can come. And that can just make it take a little bit longer through each stage of labor. Breech baby is where essentially a baby's butt is presenting first or feet are presenting first rather than their head. There's a couple variations. They can also be transverse, which is where they're side to side. Breech vaginal birth is possible in some places. Unfortunately nowadays, because of the litigious nature of obstetrical care in this society, not a lot of providers either are comfortable offering breech vaginal birth or perhaps their malpractice insurance simply doesn't allow them to offer breech vaginal birth. We unfortunately can't offer planned breech vaginal births here. However, if your baby is found to be in, a not ideal position in the 3rd trimester when we're wanting them to flip, we have several options that we can look to help that baby rotate into a better position for labor. The transverse lie is where the baby's lying side to side. So the head would be on one side of mom's body and the butt on the other. And then there's also oblique, which is kind of diagonally. And there's also something called transverse of the head, which sometimes we will say the baby's head is transverse and you'll see the mom go, oh no, transverse. But the head alone can be transverse, which is where their head is sort of sideways like this in the pelvis instead of straight ahead. So that's very different and much easier to fix. Transverse lie is when the whole body is side to side in the uterus.